Queenslanders are being encouraged to voluntarily don masks again to protect themselves against COVID-19, with experts saying it is too early to declare the pandemic over. Key points. Health authorities are expecting a surge of the highly contagious BA-2 subvariant to arrive in Queensland in coming months. Health authorities are expecting a surge of the highly contagious BA-2 subvariant to arrive in Queensland in coming months, and infectious diseases experts says the state's rate of booster doses administered is nowhere near where it needs to be. An infectious diseases experts says the state's rate of booster doses administered is nowhere near where it needs to be. Queenslanders have again been urged to wear masks in poorly ventilated indoor settings. Daily case numbers and hospital admissions rose for 4 days this week in the Sunshine State, triggering concerns about the potential for a significant resurgence in infections leading into winter. While Omicron's BA-1.1 variant dominates cases in Queensland, the highly contagious BA-2 subvariant is expected to surge as the year progresses. Queensland's catastrophic floods have taken the focus off the pandemic in recent weeks, but experts warn measures are still needed to control the spread of SARS-CoV-2, the virus that causes COVID-19, which has already been linked to 673 deaths across the state. Of those, 138 have been recorded in March so far, 20.5% of the state's total since the pandemic began. The Queensland spike in daily cases comes as the World Health Organization warned countries to remain vigilant against the virus amid a jump in infections worldwide. Put that mask on. While not wanting to alarm people unnecessarily, infectious disease specialist Paul Griffin said he was concerned public health messaging had pivoted too quickly to an overly reassuring message that has led to people thinking they no longer have to do anything to keep controlling this virus. Dr. Griffin said while masks were no longer mandatory outside health, aged care and prison settings, public transport, airports and planes, people should consider wearing them in other situations, particularly in poorly ventilated indoor spaces when social distancing is difficult. Paul Griffin urged Queenslanders to put masks on when in doubt. We know the highest risk situation is prolonged indoor close contact, Dr. Griffin said. I think if you're in an indoor space for prolonged periods, and particularly if there are a number of people there, then that's a really good environment to put a mask on. Queensland COVID-19 snapshot in latest reporting period, S11. 11 new cases. 6,103 Queensland's vaccine rollout. First dose, 93.22%. 93.22% second dose. 91.39% latest case information from Queensland Health. Dr. Griffin, an associate professor at the University of Queensland, said he planned to take a mask this weekend to the football. I'll wear a mask certainly on the way to the game and getting in and out of the area where I'm sitting, but given it's outdoors and we have a fair bit of distance, I'll probably take my mask off for the duration of the game, but then put it on again for the exiting and travelling home, he said. If you're going somewhere to see a show or to be in close proximity to people indoors, then I'd potentially put a mask on. For common things like shopping, if it's not very crowded and you can be socially distant, you may not necessarily need a mask. But if there are lots of people there, such that you are in proximity to people that you don't know, then again, I'd probably put that mask on. It's just about making those assessments at the time, having the mask handy and popping it on if you are in any way worried that there's a risk. UQ Virologist Associate Professor Ian McKay also urged people to continue wearing masks in high-risk settings. He advised Queenslanders to consider upgrading to an N95 or P2 mask, rather than cloth or surgical masks, for better protection against aerosol transmission of the virus. It's disappointing that we don't still understand that the virus is out there, Dr. McKay said. We can reduce the likelihood that we get sick, our family gets sick, and someone who's maybe not vaccinated gets really sick, by still using these non-pharmaceutical interventions. Masks should never have come off without more communication about it being acceptable to keep wearing them. The rate of Queenslanders with their third booster shot is nowhere near where it needs to be. That's especially for those with underlying medical conditions, but also for those sensibly wishing to avoid infection and illness. Masks help reduce both the viral dose that you're likely to get from someone who's infected and the chance that you'll get enough at all to get infected. Why would you risk your chance of getting infected by not taking some sort of intervention? Rate of booster vaccines plateaus. Dr. McKay said research showed COVID-19 affected patients' hearts and brains, potentially impacting their health long-term. As a population, our life expectancy may even dip in future because of complications from severe disease, he said. You go back to the question, could we have changed that? Would wearing a mask have meant that we didn't get as sick if we did get infected? Both Dr. Griffin and Dr. McKay said they were also concerned about the large numbers of Queenslanders who had not yet received their third dose of a COVID-19 vaccine. Our rate of boosters has certainly plateaued, and I think that has to be addressed, Dr. Griffin said. It's nowhere near where it needs to be. It's really that booster that not only gives you more protection against severe disease, but also more protection against getting infected and passing it on. Just 61.1% of Queenslanders aged 16 and over have had their booster shot. Under changes to Queensland's public health directions, from March 31st, all aged care workers must have received their booster vaccine within 6 months of getting their second dose. M to mute, left and right arrows to seek, up and down arrows for volume. Watch 15 minutes 2 seconds 15M. Will winter bring a COVID-19 onslaught?